Good morning, Johnny. My name is Isra. I'm going to be your nurse today, and we're going to do some respiratory management with you. What I'd like to do is, before we do that, I'd just like to confirm that your name is Johnny Bravo, and your date of birth is 3/15/78. Okay. So what I'm going to do here today, Johnny, is I'm going to do an assessment on you. I'd like to have you sit up, leaning slightly forward. So we're going to do that, help you to sit up, and you're going to lean slightly forward. And I'm going to listen to your lungs. Now, the doctor wants you to do some breathing into the spirometer. Do you know why the doctor wants you to do that? You're not sure? Okay, well, I'm going to explain that to you. The doctor wants you to do the spirometer because it's respiratory hygiene. It helps to clear the mucus out of your lungs. Along with that, we're going to want you to stay hydrated, and we're going to want you to drink plenty of fluids. But let's get to the exam part of it. I'm going to listen to your lungs, and I'm going to put my stethoscope in 5 different spots. 2 upper and lower on your right, on your left hand side, and then 3 spots on your right hand side. So 2 spots on your left hand side, 3 spots on your right hand side. So we're going to do upper, middle, and lower, and the spaces in between your lungs on the right hand side. On the left hand side, we're just going to do upper and lower. All right, now that I've had a chance to listen to your lungs, I can hear a little congestion. But what we're going to do is test your oxygen levels. Let's do that. Use my oximeter here. And I'm also going to check your fingers here just to make sure they're the right color. So your oxygen level currently is at a 94%. Your breathing room air. I'm going to provide you a receptacle just in case you need to spit while we're doing this. I'm going to have you take some slow, deep breaths. And I'm going to listen to your lungs, okay? So just the same way that I did before, but only this time you're going to take slow and deep breaths. I have some mouth swabs here we're going to do. We're going to clean your mouth just to make sure that everything is okay there. And I do want you to make sure you keep your mouth clean after each meal. So once you eat food, I'd like you to have your mouth cleaned out as well, okay? So we got these glycerin suppositories to clean your mouth out. Good to go. And now we're going to have you do the spirometer. I'll have you breathe in that. We're going to do 5 counts of the spirometer. So here you go. And I'm going to have you breathe in deep and then breathe out as hard as you can. We're going to do that 5 times, okay? All right. Now that you've done the spirometer, we're going to go ahead and check your oxygen level again. And I'm going to listen to your lungs once more. Just going to have you take slow, deep breaths for me. Okay. Sounds good.